Welcome to Health Coach Talk. We hear a lot about functional medicine doctors. We know, though, that oral health is critically important for overall health. And yet, for many people, they see conventional dentists who are focusing on drill and bill. And that would be about it. And that was my experience. My experience growing up. I had a mouthful of cavities, had mercury fillings, had those removed, and I had worked with a number of dentists, but never really found the right one until I happened upon the person who is going to be our special guest today. Her name is Dr. Eniko Loud, and she is truly a trailblazer. Let me tell you about Dr. Loud. She is a trailblazer in holistic dentistry, seamlessly integrating her extensive background in functional medicine, Ayurvedic healing, and intuitive health practices into a revolutionary approach to patient care. With a foundation rooted in comprehensive medical training and advanced expertise in oral health, Dr. Loud bridges the gap between ancient healing science and modern medicine, offering patients a transformative whole body experience. This is dentistry like you have never seen before. So let me again welcome Dr. Eniko Loud.
Thank you for having me. It's
Um,
exciting.
So I would love if you can tell our listeners how you got into holistic dentistry, or by some people call it biological dentistry. We can talk about any differences there, and your interest in functional medicine, because you are one of the few who focuses as a dentist on functional medicine as an approach.
So I was actually a trained medical doctor in Europe. I had a dual degree in Europe, and I always had, since childhood, since I was probably 5, a love for the whole body and understanding how everything is connected. I was just so fascinated with the human body. And so when I came to the United States, I went to dental school and I started practicing, and I realized that it's a disease care model and something was missing. People are not getting better. People are getting more cavities, and they don't own it, and there's no end to it. So I started searching, and I got into joined the Holistic Dental Association, but I still didn't find kind of answers. And I'm a bit scientific, so I like data and I like research, and I like to not experiment. I like to know if I'm doing something, it's been verified. And a friend of mine at the Holistic Dental Association actually told me, I think based on the questions you're asking, you really should look up IFM. And so it happened that there was a course on cardiometabolic disorders, I think that weekend in Phoenix, and I attended it. And I remember Dr. I think it was Saxena that was talking about diabetes and how diabetes is reversible. She showed how she reversed her dad's diabetes. And I said, wait a minute, in dental school, they teach us that once you have diabetes, you have it. Just like once you have gum disease, you have it for life. It's nothing you can do about it. So it was like a huge paradigm shift. And I was like, okay, I need to understand this more. And I really just like immerse myself in functional medicine, and I wanted to understand it as deep as I could. So I figured getting certified was the best way. Yeah, because there's a lot of studying and a lot of learning. So I committed to the path at that moment. And then I slowly, as I was learning, I started seeing the connections between what people were doing and how they were living and how it was manifesting in their mouth. And I could see metal toxicity in the mouth. I could see how like current exposures to some toxins could cause burning mouth. So I was connecting the dots, and I was getting so excited. And I realized there's no other way to practice but to start bringing it in and kind of follow the functional medicine model.
Well, I'm so glad you did, because I found you as a dentist, and my history with dentistry goes way, way back into childhood with mercury amalgam fillings and just a lot of dental procedures. And It was always an area where I wish I had known sooner. Good dietary habits when I was much younger, for example, did not follow that. And it's led to a number of dental issues. And I found you, and I've got to say that the experience I had walking into your office from my conventional dentist was night and day. The way you analyze so many things that a conventional dentist overlooks, and the care, but even down to the environment, which just is healthy. You don't have the toxic mouthwashes, for example, or air fresheners all around, and your use of cutting edge X-ray technology. So it's quite a different experience. So, what are some of the most egregious things you have seen in terms of conventional dentistry, where people are just on this path? There are just more and more issues pop up, and often as a direct consequence of bad dentistry.
One of the biggest one is really bite related. So, majority of dentists don't really understand how a proper bite is connected to the muscles, to joints, the whole posture, and the airway. And oftentimes, a person gets a crown, or let's say they crack a second molar, which is the most common thing. Nobody's asking, why is this happening? That's one of the things that was big in functional medicine. Why is this happening? What is the true root cause? And a patient just gets a cap and a crown, and eventually that breaks. Then they get a root canal, and then eventually gets this tooth extracted, and nobody's really asking, hey, why is this happening to this person? And then that's how people end up losing teeth or end up getting root canals, because oftentimes the problem with the second molars is that they are out of alignment, or something that is causing misalignments in the jaw joints, and muscle activity changes, and then they start overloading. So that's one of the most overlooked problems. 90% of dental diseases are probably caused by imbalances in a bite. And then teeth end up wearing down, chipping. So I think that's one of the biggest things that are neglected. And then just not asking why this is happening, why somebody's getting a lot of cavities, or why somebody gets often mouth ulcers. And then the patients just end up getting patchwork dentistry, and eventually they get worse and worse. And they just think that's part of aging.
Well, I know this. You noticed issues with my bite, and you fitted me for a night guard. Would
Yeah.
that be the approach, as well as, of course, a holistic approach where you look at other factors as well? But
Yeah.
is that one of the things that you
That's
would
one of the
typically
things. It's
recommend?
not just a night guard. It's really actually designed, and it gets adjusted over time to start balancing the joints. Because oftentimes when the joints are not loaded properly, imagine like excessive forces moving the joints out of their socket and not evenly functioning. Just like one leg will be shorter than the other, eventually the whole system starts showing stress. And these appliances are specifically designed to create like a balanced base, where the muscles and the joints, through the adjustments, can find their like neutral state where they're not in stress. And actually, if somebody gets thermal scans, we could see very clearly which muscles are really out of balance, because when there's imbalance, there's inflammation.
Can you describe thermal scan? What is that? Is that something
Uh,
that you do?
I don't do that, but there's many places around here that do thermal scans. It is used also for early cancer detection. They I think it's like a thermal imaging, because the body emits certain thermal signals, heat or cold. So when an area is cold, there's lack of blood flow. So it could be an area of problem for cancer, or if there's too much blood flow, shows up green. I'm sorry, red, and that's a sign of inflammation. So it would be like, imagine a picture of yourself, but only in colors. So if there's inflammation in the joints and the muscles, this area would be red. So that's how we know where inflammation is localized when it comes to the thermal signature of a human being.
That's fascinating.
Yeah.
I want to talk a bit about dental hygiene. Sometimes there's conflicting advice out there in terms of how should we be caring for our teeth, and does that change as we age? Are there some things that we need to be perhaps pay more attention to in terms of the care of our teeth?
That's a very good question, and And the answer to that would tie into what I'm studying now, Ayurvedic medicine, which is a very ancient medicine that recognizes that we actually go through stages of life, and there's some changes that happen during those stages that are very specific. So as we age, we start drying out. And everything becomes drier because there's the air and ether element. And so as we age, it's very important to use oil-based mouth rinses, oil pulling, to reestablish moisture to the oral cavity. We become, as we age, sometimes less prone to cavities, and we're more prone to gum disease. There's always a shift in the microbiome, and that could lead to gum disease. So people can become more prone to gum disease. When we're younger, like really young, we're more prone to cavities because of the lack of care, and kids try everything and they eat more sweets and carbs. Kind of like the middle part of our life, we're a bit more stable. Most people say, I haven't had a cavity since I was like in my 20s, because we become more aware of what we need to do. So brushing and flossing should happen twice a day for everyone. If somebody is dealing with sleep apnea or drier mouth or digestive issues, probably adding in that third time is really good, just to prevent food from building up. And then using oil-based mouth rinses, it's really healthy actually for everyone. But as we age, that's even more important.
Yeah, after my consultation with you, I really upped the ante. I had been oil pulling a few years ago, got out of the habit, and starting that again, as well as another I've learned from other people as well, and hadn't been doing that regularly, which is tongue scraping. Can you
Tongue scraping.
describe the benefits of tongue scraping?
So as you know it, and everybody in your community knows it, liver detox is at night. And then the detox process happens at night. All the toxins are clear and cleansed out of the body and deposited into the digestive tract. That's why we go to the bathroom first thing in the morning. A healthy person goes to the bathroom first thing in the morning to release the toxins. And part of the oral cavity is part of this digestive tract. So there's a tendency to have some buildup on the tongue because the toxins come out. So cleansing the tongue in the morning, early in the morning, removes those toxins, stimulates the taste buds. It also removes any type of toxins that bacteria could be using as a breeding ground. And then in Chinese medicine, Ayurvedic medicine, every organ is represented on the mouth. So you're actually massaging those internal organs, just like acupuncture and acupressure to the hands and feet. When you're scraping, you're massaging your internal organs and toning them.
That's just fascinating. Yeah, and so I'm definitely making that a part of my routine. Is there an ideal time to do that tongue scraping? Is it the first thing you do before you brush your teeth?
Yes, that should be the first
Yes.
thing to remove it. Yeah. And then sometimes people use their toothbrush. I don't recommend that because then you're just pushing the toxins into the toothbrush and then you're brushing your teeth with it. So then again, that toxic buildup is like a breeding ground for bacteria. So copper tongue scrapers are the best because copper is antimicrobial, and the energetics of it also helps cleanse. Actually,
Yeah,
Ayurvedic medicine, the right way of doing it is to clean the eyes, maybe use some rose water to clean the eyes, then clean the nose, and then clean the mouth. Because the mouth is part of our senses. We communicate through our mouth, we taste, and then the mouth and the nose, the taste and the smell are very much connected. So this way you're getting your senses ready for the day.
that is beautiful. I love that, and I hadn't thought about that. One area that I think people are sometimes obsessed with are mouthwashes. And I know I've heard a lot of, there's a lot of problems, especially the really strong, the Listerine, the antibacterial. Can you talk about that and what you see in your practice or just in general public, people who are using or perhaps overusing mouthwashes? Is there
Yeah,
a
there's this
good
trend.
one we should be doing?
Two different kind of antimicrobials try to kill everything, and then even dentists prescribe chlorhexidine, which is really harsh. It actually prevents the growth of fibroblasts, which are cells that help repair tissues. So, um, uh, our microbiome is very much part of us. And, in functional medicine, they teach that our microbiome is what helps us be healthy. So these alcohol-based antibacterial, anti-plaque, anti-everything, they tend to wipe out the good bugs also. So they, again, create a breathing ground for problems. And then our own bacteria help digest carbs and help break down toxins, and it just disrupts that. So I'm not a big fan of Listerine. Also, they add coloring agents in them and all types of chemicals. Um, it, Anytime something is in a plastic bottle, then the plastic leaches into it, and it's just a mess. The best ones are, I still would go, the simplest thing, coconut oil pulling. It's simple. There's just one ingredient. Or there are other like whole food cells, like essential oil-based oil pulling. Or actually, one of the best things is make some herbal teas and rinse with that. Like chamomile tea is really good. Or coriander. You could take coriander seeds, crush them, and then soak them in water overnight, and then just strain it and rinse your mouth with that. That's an anti-inflammatory. So simple things that we have in our kitchen we can use instead of spending a lot of money on these expensive chemical-based mouthwashes. Um,
Those are great suggestions. I love that. I'm going to try those. So is it possible then to restore our oral microbiome? Let's say we have been using those commercial grade built products like Listerine that are
yeah.
mouthwashes that are very harsh.
Of course it is, because our body knows how to get back into balance. But I think a big part of that is a really healthy diet, so we get the nutrition that we need. The other thing that can disrupt the healthy microbiome is mouth breathing. And a lot of people tend to do that, or like they or people that talk a lot, that can cause disruptions in their microbiome. So paying attention to breathing through your nose more, and even at night, breathing through your nose to help that bacterial population be healthier, because dryness dries them out, so they can't thrive. But yeah, definitely. And you can use oral probiotics, just like in the gut. These are transitional, so they don't really last, but they can help upregulate the immune system and then help reestablish a healthier flora. So just kind of bring back a little bit of balance so your microbiome can regrow. But a healthy diet, like the rainbow diet, I'm a big fan of that, or the Mediterranean diet. Those are great because health comes from the inside, from the gut. They actually did these studies many, many years ago, very kind of controversial and not very nice of a study. They took radioactive isotopes and like they put them in food particles, and then they had dogs eat that. And then they were trying to see how long it took from the stomach to get into the teeth. And it took 5 minutes. So as we absorb foods from our stomach, that ends up in our teeth. So it's very important that we eat the right way, because that nourishes our oral environment.
So once again, looking from a functional medicine lens, we're really addressing those lifestyle factors, and namely your nutrition, where we can significantly improve our oral health, as well
Yeah.
as our overall physical health.
And there's two other things that disrupt the microbiome severely. So if somebody wants to reestablish is sleep, again, the lifestyle. So at least being in bed and asleep by 10 and sleeping 7.5 hours without sleep. If somebody stays up at night all the time, that will disturb the oral microbiome, because the detox process is not happening and toxins accumulate. So the microbiome thrives, the bad bacteria thrive in this toxic, laden environment. And then also, oh gosh, I want to say it. It was sleep and it slipped from my mind.
And
breathing.
stress, potentially.
Yeah, stress.
Sleep,
Yeah, that's what it
breathing,
was. Stress.
yeah.
Yeah, because I've seen
Yeah.
patients. We test saliva, so we test the microbiome just like a gut test. The microbiome in the mouth is very much affected by stress. I've had patients that went from healthy microbiome, and we tested 6 months later when the spouse passed away, and it was off the charts.
Wow.
Really harmful, really, really, really aggressive bacteria, off the charts, full. And it took a long time to calm it down. It was purely stress that triggered that inflammation.
Wow.
They already were prone to it. So yeah.
Yeah. Yeah. So once again, the importance of lifestyle factors, and health coaches are the specialists in lifestyle factors, can really help people who are struggling, or perhaps, they see their dentist and they are getting a bad prognosis on terms of their oral health, but addressing these factors that dentists overlook. I've never had a dentist other than you look at these factors.
Yeah.
They're basically take an X-ray, fill and drill, and
Yeah.
but health coaches can be the ones who can really help people to maintain their oral health, restore their oral health.
Yeah, we work with the functional medicine health coach and nutritionist. So that's a huge part of what we do because it's so important. You can't get better if the lifestyle is not addressed. And most people don't really know. Yeah.
Yeah,
That's another
absolutely.
thing. Health coaches, what you're doing is amazing because the world needs a lot of it.
We need millions more health coaches, and wouldn't it be incredible if health coaches could really look at oral health and help people, and if dentists can refer people rather than just filling the
Yeah.
cavity or recommending an implant or a root canal, but actually start way before then
Yeah.
to help people with these factors that you're describing, that
Yeah.
are stress, and having immediate purpose in your life is
Yeah.
going to be anti-inflammatory, and of course what you're eating or not eating, and
Yeah.
that contributes, as well as motivation to have good oral hygiene, and many people do
Yeah.
not. It's amazing
Yeah.
how many people don't floss, for example. Or,
Yeah, totally. I think that I mean that could be a huge potential for like health coaches to go out and connect with some dentists because there's a huge need for it.
yeah,
Yeah.
yeah. And often that's when I think they might be most receptive if they are told, "Oh, this is something down the road. You might need this," and it's nobody wants a dental procedure. And if I've had enough of them
Yeah.
in my lifetime that know that they are not fun.
Yeah. Or even if they have like oftentimes people have surgeries, like massive dental surgeries, and how
Yeah,
be to introduce the diet and lifestyle so they heal faster. Um, and then they recover better and they don't have as much pain and procedures go well.
yeah.
Implants can fail if somebody has a really poor, gut immune system, a lot of stress and poor diet. They can fail, and that's a lot of money that they waste.
Oh, absolutely. That's so true. So suppose somebody what are some of the signs? What should they look for? Let's say they're wanting to get a new dentist, and often they're in an area where there might not be the holistic, or well, first of all, can you explain the difference between a biological dentist and holistic dentistry? Is there a difference?
I think those are labels. Biologic dentists are looking for um, um, preventing toxic materials from going into the mouth or removing toxic materials. Holistic dentist is very similar, but holistic meaning like they try to look at the whole body and connect the dots between the body and the mouth and how that's influencing somebody's health or disease states. So that's kind of how you can make a distinction, but it's becoming a trend. So you have to be careful with that because a lot of people just, call themselves holistic or biologic, and it's a trend now because we're realizing that there's a need for it. American Academy of Oral Systemic Health, I would say that would be a good resource. I think it's AAOSH, American Academy of Oral Systemic Health. That's a pretty legitimate, very much dedicated to systemic well-being and connecting the dots. And all the dentists that I've met through that were really amazing dentists. And I think they're all around. That would be a good resource.
That's great. We will make a note of that. And what are some of the things that would be important to look for? Perhaps you are seeking a new dentist,
Yeah.
or
I think if I was a patient looking for a dentist, I would call and find out if they have a getting to know you appointment. Because I think that's so important. I learned that from functional medicine, how important it is to sit with the patient and know what they want and what their goals are. It's like having an appointment where the dentist will just sit with you for an hour or half an hour and know what your wants are and what your concerns are, instead of just kind of, you're like moving through. And then kind of look on their website, what they're dedicated to, what they're learning, and ask some questions like, what is the philosophy of the dentist about overall health? How's the mouth affecting the health? And then I think you'll find out some information. Also, make sure they wear magnification loops, like high magnification loops, because you can't really see after a while. So that allows for more precision in their work.
That's a good point. Something to know. Yeah, I see ads all the time about come in and in one visit, you'll get Invisalign, you'll get implants done, and you'll walk out you'll be a brand new you with new smile. What would you say from those kinds of those approaches or advertising?
Well, they're focused more on the process, on the procedures versus the human being. Um, and I and I it is just unfortunately what dentistry became, like get it all done. It's like it fills some people's needs that want to get it done fast. But I think if you want to have quality care, you need to have a relationship and a partnership with the dentist. Because if you go into a dentist, it should be long term, not just like in and out. If all you're needing is just getting something done quickly, there are plenty out there. But if you want a long-term relationship with the dentist that looks out for you and pays attention to things that could go wrong in your health based on your mouth, then maybe do those interview questions. Yeah.
Yeah, absolutely. And really, this is so similar to what we would look for when we're looking for a medical practitioner.
Yeah.
Unfortunately, modern medicine has become just this in and out, and you're given 10, 15 minutes, and they don't even know your name or make eye contact in some cases.
Yeah.
And you feel like just a number, and there is no relationship that's created. So I love what you're saying. It is relationship based. They know you, and a real win, a home run, would be if they had a health coach or referred to a health coach and
Yes.
appreciated the importance of the lifestyle factors that we've been discussing.
Yeah. I have this big dream of changing dentistry somewhere or another.
Well, I'm right there with you. Yes, exactly. Because I think, people, they're in the chair, they're captive when they're seeing their dentist. And what an opportune time for the hygienist, for the dentist, for the health coaches in the office to address those whole health factors.
Yeah. As a matter of fact, patients see their dentist more often than they see their medical doctor.
Yes.
Most patients do. So it's a privilege. That we get to serve that way. And I think if more dentists saw it that way, dentistry could change. The
Absolutely.
responsibility also. You
Yes.
when you care, if somebody comes to see you, you have a responsibility to care for that human being.
That's so true. Well, I admire you. I admire the work that you are doing. It's I chose you as my own dentist, and your practice is called Whole Health, and I think that really says it all. That you are not just fill and drill or refer to a root canal. The drilling doesn't work. Uh, so, Dr. Loud, where can people find you?
WholeHealthDentistryAZ.com. And on Instagram, Dr. Eniko Loud. I post videos about certain topics, so they might be interesting to learn about some things for some people that are interested.
Well, this has been just a pleasure to talk with you, and you are a real trailblazer, a dentist who is a whole health dentist and a practitioner of functional medicine. So thank you so much.
Thank you. Thank you. My pleasure.